I will discuss Ramsay Hunt Syndrome. So in case of Ramsay Hunt Syndrome, there is activation of the reactivation actually of Varicella Zoster Virus, leading to inflammation in the geniculate ganglion. Geniculate ganglion inflammation leads to cranial nerve 7 involvement, that is facial nerve palsy, and also sometimes at nerve involvement. And at nerve involvement leads to hearing loss and tinnitus and vertigo. Tinnitus and vertigo. Now when there is cranial nerve 7th involvement, it leads to your palsy of facial muscles. But it is lower motor neuron lesion. Lower motor neuron lesion involves your whole face. In this way, you can differentiate lower motor neuron lesion from upper motor neuron lesion, because in case of upper motor neuron lesion, you are able to frown, but in case of lower motor neuron lesion, you are unable to frown. So, Ramsay Hunt syndrome is a peripheral facial nerve palsy that is characterized by a vesicular rash in the ear canal. There is presence of vesicular rash in the ear canal, and it is due to reactivation of Varicella Zoster virus in the geniculate ganglion, as I have told you. There is reactivation of the latent Varicella Zoster virus in the cranial nerve 7 and sometimes involvement of cranial nerve 8. So this is the etiology or cause. It is triggered in those people who are immunosuppressed. It leads to inflammation and nerve dysfunction. Clinical features. When there is involvement of the ear, it leads to ear pain, otalgia. There is vesicular rash on examination in the external ear or tympanic membrane mostly, and there is ipsilateral lower motor neuron facial nerve paralysis. As I have told you that the frowning is also disturbed in case of lower motor neuron facial palsy, while in case of upper motor neuron facial palsy, frowning is intact. So in case of lower motor neuron facial palsy, frowning is not intact. It is similar to Bell's palsy but more painful and more severe. Vestibulocochlear nerve is when involved. I have told you there is tinnitus, vertigo and hearing loss. There is altered taste because anterior 2/3 is supplied by the facial nerve. Therefore, anterior 2/3 is supplied by the 7th cranial nerve, and when 7th cranial nerve is involved, there is alteration in the taste. Hyperacusis is due to the involvement of the stapedius muscle that is also supplied by 7th cranial nerve, and this stapedius is responsible for dampening of loud voices. And when there is stapedius involvement, then there is hyperacusis. Also, there is dry eye or mouth. Diagnosis. There is a classic triad. First one is ear pain, second one is presence of the vesicles in the external ear canal, and third one is facial nerve palsy, which is lower motor neuron facial nerve palsy. This is third one. How will you diagnose this? You can diagnose this clinically or PCR for Varicella Zoster Virus serology if you are uncertain. And audiogram MRI can only be done if there are atypical or there are complications. Treatment. You have to start the treatment within 72 hours. You have to give acyclovir 800 mg per oral 4 to 5 times a day for 7 days. So acyclovir can be given, valacyclovir can be given, and you have to give prednisolone 40 to 50 mg for almost 5 to 10 days. So this combined therapy is required for best outcome. Analgesics or NSAIDs can be given for otalgia, and as you are unable to close the eyes, so eye protection is required, like lubricants, taping the eye closed, or during sleep you can do this tape for closing the eyes. Vestibular suppressants can be used if vertigo. For example, prochlorperazine or beta histine can be used for prochlorperazine pyrazine or beta histine can be used for this purpose. So this is all about Ramsay Hunt syndrome.